I'm with Dr. Marcelo Matos, and he's on the CNO Board of Advisors. He's a radiologist and a TMJ/D specialist. In Brazil, they actually have a specialty. Marcelo, what do you think about the CNO Symposium, the virtual symposium that we're putting together? Can you tell us about it? What do you think? What's going on with it?
I think it's a great opportunity to meet so many incredible brains that has this focus on TMJ occlusion from a perspective much more systemic and measurable and like out of the box. Are great people. I know some of them, and I know that everybody who jumps in, goes to this meeting, will enjoy a lot. Of course, this is a challenge because initially it was supposed to be physical in Utah, right?
Yep,
and
Utah.
I know that Utah, it's going to be a challenge, but I think it will be a very, very interesting challenge and a very enjoyable meeting.
Yeah, doing it virtually is totally different than what we had planned, isn't it?
Totally different, totally different.
But yeah, but you're going to be talking about TMJ Pathology Screening, right? And you're also going to be talking about anterior open bites. Yes.
Yes. And this open bites is kind of, let's say, something to show the tip of the iceberg.
Yeah, that it is.
The tip of the iceberg. It is a word. No, let me ask you something. How many dentists that may be watching this conference somewhere, and if you are watching this conference, I would like you to think how many class 2 patients arrive daily at your office or monthly at your office. How many of them has open bites, and how many of them have ever thought about being a TMJ pathology problem? Or how many times you thought in terms of occlusion? If you thought about occlusion in terms of orthopedic, it's nice, but put it all together. The bottom line is, would you like to see why so many open bites? Why, let's get better. Would you like to understand why so many occlusal problems, including open bites, are very prone to relapses or to create limitation for the dentist?
Yeah.
And if you would like to see that, I would like to invite you to take a look at this perspective from the TMJ point of view and from the perspective of the systemic part, from a systemic view of human function in terms of mandible and mandibular complex. So
yeah, based on science, objective science.
Based on science, measurable science. So it's not something that just out of our minds. It's something that has been mounted stone by stone from all those great brains that came before us and people that are working in this field. So Dr. Learreta liked to say, quoting him, I didn't invent anything. I read everything.
Yeah.
he starts to read everything, and since he's he's a clinician, he's in the field. He's like a fighter in the cage, in the UFC cage. He's there. He must to use things that work, because if not, we're gonna
he's out of business. If it doesn't work, he's out of business.
Gonna be in trouble. So this is interesting because it makes us read and look for solution for a patient and apply stuff that you can do it over and over again. It's not something that you do like magic. If it was something that only the Learreta could do, and me, for example, as his student, couldn't do, would be something like a sorcerer, right?
Yeah, we can all do it if we learn how. We can all do it.
That's something that you can teach and pass on.
Yeah,
so
and this is everyday dentistry. It's not just the TMD world. It has to do with our crowns, our bridges, our implants, our cosmetic dentistry, everything.
How many times, Nick, we see patients break bridges and break teeth? Let's say frontal teeth. Oh, I would like my teeth a little bit bigger. And you grab, you work, and then boom, it breaks over again.
Yep.
How many times do you see that stuff going on?
All the time.
The question is why? And measuring gives us the opportunity to get deeper in this stuff.
Yeah, for sure. All right. Well, thank you very much. And we're looking forward to both talks.